Good evening, everyone. My name is Kevin Clesham, and thanks for the opportunity to present here today. I'm presenting this on behalf of the team at the Mater Hospital in Dublin. So I'm going to start with a question. What do spine surgeons fear? I'm sure if I went around the room, I would get a lot of different answers. And some would probably say that spine surgeons have no fear. But two themes would emerge, I'm pretty sure of it. Complications and getting sued. There are many papers in recent years identifying all the different complications that can occur with spine surgery. We have infection, pneumonia, DVT to start the list off, and we have much evidence to identify how we can minimize these complications. Litigation, on the other hand, is a little bit trickier to navigate. The Montgomery case in 2015 was pivotal in highlighting the importance of consenting for material risks for spine surgery. Recent papers have shown that the proportion of litigant cases that are due to lack of informed consent is actually pretty high and goes up to 29% in some papers. So this formed the basis of our study. How can we tackle these problems? How can we get our patients to understand that complications are going to happen and to understand what the percentages are and what the risks are? We know that leaflets and websites have been used to great effect in the consenting process. However, the use of videos, specific videos for procedures, is a pretty novel idea still. So that's what we did. We created a focused video for lumbar discectomy and decompressions with one of our senior authors, and we amalgamated that with a type of an animation that goes through everything from the general anesthetic all the way through to the surgical procedure itself. Our main aim was to see if a video added to the normal consent process would improve the patient's understanding of the procedure and also to improve their recall of the different risks that are involved with lumbar spine surgery. So we got local ethical approval, set up an RCT. The control group were consented as usual, usually on the day before, the day of surgery. And then the study group had the addition of a video in the week prior to their surgery. We had a post-op questionnaire that had three main parts. There was a patient satisfaction component, the number of complications they could recall, and then a 10-point questionnaire on different aspects of the video. So the overall satisfaction was very high. All patients enjoyed the video and felt it made a massive difference to their understanding. The study group recalled more complications than the control. On average, they had about 7.5 versus 3.6 in the consent-only group. They were also able to identify common and uncommon risks more readily than the control group. The overall score in the questionnaire was also higher, 7.2 versus 5.1. And then in particular, two questions related to DVT risk and dural tear were also scored much higher in the study group than the control group. And we feel that these are particular issues that sometimes patients don't fully understand and can have make a significant difference to their aftercare. So our study has shown that the addition of a video improves the patient understanding of the procedure and also their recollection of the complications involved. It's a low-cost solution, and through our satisfaction study, we know that the addition of a video can help the patient's anxiety levels perioperatively, which is also an important factor in them retaining information. It can potentially play a role in reducing the levels of litigation. We didn't look into this. It's a very complex question to answer. However, one would assume that by having the risks and complications, as you can see here in this video on the screen, it will give them enough time to digest this away from the healthcare setting and potentially lead to them retaining more of that information. Some of the limitations were patient anxiety perioperatively has been shown to have an effect on how much they can recall, which is understandable. We didn't measure this. There was a bit of heterogeneity in that some patients were trauma and some were elective. And there are some questions remaining, such as when should we expose the patients to these videos? Should it be a week in advance or longer? Do they retain this information long term? Studies would tell us that at 6 weeks they forget everything they've been told, but further research will answer that question for us. And how do we identify patients who will benefit most? So ultimately, the take-home messages are that the addition of a consent video to the consent process will improve patient understanding of the procedure, their recollection of complications, and their overall satisfaction rates. It's a low-cost addition to practice, and it has the potential to reduce litigation due to inadequate consent. Thank you.